Hey guys, I'm going to talk to you about Takayasu's arteritis. What is it? Takayasu's arteritis is a type of giant cell arteritis and a rare type of vasculitis in which a group of disorders cause inflammation to your blood vessel. In Takayasu's, the inflammation damages your aorta and its main branches. It primarily affects Asian women younger than 40. Sometimes the condition is hereditary. What causes Takayasu's arteritis? It's unknown. Some evidence suggests that an infection of some kind, whether it be viral, bacterial, or other, occurring in a person that has other factors, may lead to the disease. However, evidence of this is lacking. The symptoms of Takayasu's, they say it occurs in 2 stages. For stage 1, you may or may not notice them just because it is possible for the inflammation to damage your arteries for years before you even realize something is wrong. But if you do notice the first stage or have the first stage symptoms, it is fatigue. You'll have unintended weight loss, muscle and joint aches and pains, mild fever that is sometimes accompanied by night sweats. And then we'll go on to stage 2. So during the second stage, the inflammation causes your arteries to narrow, so that allows less blood and oxygen and fewer nutrients to reach your organs and tissues. So the symptoms that you'll feel with this would be weakness or pain in your limbs with use, lightheadedness, dizziness, or fainting. You may have headaches. They have said memory problems or trouble thinking is a stage 2 symptom. You'll obviously have chest pain or shortness of breath, high blood pressure, blood in your stool, or it can cause you to be anemic. How it's diagnosed is difficult because it does rest in the vessels for years, and some people are asymptomatic until you do have a major complication. But once it is suspected, it is confirmed by radiographic procedures such as an angiogram or MRI, and those will demonstrate the significantly large artery disease. Physicians can also make a clear diagnosis by actually taking tissues from the involved blood vessels and look at those tissues under the microscope. Takayasu's arteritis, it affects obviously your aorta and your major arteries. Those they are including the ones to your head and your kidneys. Those become inflamed. And over time, the inflammation causes changes to your arteries. They will thicken, narrow, and cause scarring. They say the condition is likely an autoimmune disease in which your immune system attacks your own arteries by mistake. With Takayasu's, extended or recurring cycles of inflammation and healing in the arteries might lead to one or more of the following complications. You can have hardening and narrowing of the blood vessels, which will cause reduced blood flow to the organs and tissues. And usually, as a result of decreased blood flow to your kidneys, it'll cause high blood pressure. You'll obviously have inflammation of your heart, so it affects the heart muscle and the valves themselves. Can cause heart failure, stroke, TIA. Can cause an aneurysm in the aorta because, it does dilate and cause your blood vessels to weaken, so they'll stretch out and they'll bulge, and they're at risk for potential rupture. You can have a heart attack. And so the treatment they do for Takayasu's, if you don't have symptoms, they won't do treatment, or you may not need it. But the most common treatment that they do is corticosteroids. They'll use prednisone to control the inflammation, but if you need it for continued use, they'll use an immunosuppressive medication. Well, in some cases, the blood vessel damage is actually so severe as to needing surgery to repair any vessel, like the aortic valve or the aorta, or some other large vessel that is affected. With the surgery, they'll either go in and stretch your narrow vessel with a balloon called angioplasty, or they could do a bypass operation. So if you scan somebody with Takayasu on an ultrasound, they said you'll see dilation of the aorta, you'll see aortic regurg, stenosis, and occlusion of the aorta. And one thing that stood out to me to remember Takayasu was actually macaroni sign. So that's why I put a group of macaroni right there. But they say the macaroni sign because it has a homogeneous mid-echoic and circumferential wall thickening, and all that's together with stenosis. And so on the ultrasound, if you're scanning abdominal aorta, this is kind of what you'll see. The blue is the thickening of that wall, and so the long of that, where you see the blue, it's kind of representing that macaroni sign, as well as these with the color on there. You can kind of see, well, you can see where the wall, you can just imagine that macaroni sign, the wall's thicker and you have that inner flow out there. And on echo specifically, you'll see the dilation of the aorta and that, and then these are just other modalities. You can see the dilation of that ascending, and then towards the arch descending area, and then up the vessels themselves you can see it's like the thickening and the thinning, narrowing of those vessels. And for this image, the image on the left is a normal ascending arch and descending aorta with the vessels to your neck and head. And then on the right, it shows the dilation. And just for this purpose, I want to say that this right image, dilation, is what you'll see after you take this echo. See, it's dilated, you know, you're confirming your Takayasu right there. And then this, it's just reiterating, it can thicken. On the right, it's really thickened, it's narrowed. It's probably, you know, stenosed through there. And then on the left, you have it dilated on the arch and the ascending. But when it's descending, you can see the vessels are thickened and just narrowed. So the prognosis for Takayasu is 10-year survival rate at 90%, but 50% of those patients will actually relapse within 10 years. They'll possibly have multiple surgeries. They are also at higher risk of infections. And obviously, if one with Takayasu, it's going to have frequent doctor's visits and imaging done, just to keep track of, you know, how the disease is going and how it's affecting you, and better make a prognosis for you. So yeah, just remember that macaroni sign when you're scanning that aorta or those vertebrals. Just remember macaroni. You may get hungry, but just remember. Well, that's Takayasu arthritis.